Hi everyone, and welcome back to Brain Evolved. Today we're exploring a fascinating and crucial topic, the COVID-19 pandemic and how it impacted brain health. This isn't just about the disease itself, but it's about the ripple effects, lockdowns, isolation, stress, and how they've impacted us. Whether you've dealt with COVID directly or you've experienced challenges of the pandemic in other ways, this is information that we all need to be aware of. So let's dive in. Let's start with the direct effects of COVID-19 on the brain. We all know that COVID-19 is a respiratory-based illness, but did you also know that it has direct impacts on the brain? In fact, up to 30% of COVID patients report some kind of neurological issue. This could be anything from brain fog to memory loss to fatigue. One of the reasons for this is because COVID-19 can cause inflammation in the brain. This inflammation damages neural pathways, which makes it harder for your brain to process information. One study even found that COVID can lead to a reduction in gray matter in an area of the brain that's responsible for memory and decision making. And for older adults, this is especially significant. A 2022 study found that older adults who had COVID-19 were more likely to develop dementia. And that's likely because of the impacts of COVID-19 directly on the brain. The good news is that for most people, these effects are temporary. However, for others, especially those who have had severe COVID, they can last much, much longer. One study found that individuals recovering from severe COVID-19 infections experienced brain decline equivalent to 10 years. While the virus itself can be devastating to brain health, unfortunately, it didn't end there. The pandemic disrupted life as we knew it, which led to a surge in stress. Financial worries, health fears, and just general uncertainty led to the perfect storm for mental issues. As we know, when we become stressed, our body produces a hormone called cortisol. Cortisol over time can impair memory and shrink the hippocampus. And this is very concerning because the hippocampus is responsible for things like memory, learning, and emotional regulation. Another challenge? Isolation. Humans are wired for connection, and the shutdown disrupted that in ways that we are just now starting to understand. For older adults in particular, this isolation was devastating, especially if they were in a senior living community. Many communities were shut down to outside visitors and canceled all forms of social activities, including dining. Isolation can be devastating for our brains, as loneliness is associated with an increased risk of cognitive decline and dementia. In addition to the loneliness that we all struggled with, there was also an increase in anxiety and depression. One study found a 25% increase worldwide during the pandemic. But there were silver linings. Many people found creative ways to stay connected, whether that was through virtual meetups or checking in outdoors. Additionally, with so much information available to us online, people began to take the initiative in their own brain health. We know this because there was a surge in the amount of brain training apps that were downloaded during the pandemic. Thankfully, we've come a long way from the early days of the pandemic. Vaccines have been a game changer, not just in preventing severe illness, but also allowing us to lift the isolation orders. And for those still dealing with long COVID, there is hope. Targeted cognitive therapy and physical exercise are showing effective for those suffering with long COVID as ways to improve their mental clarity, their brain fog, and any other kind of neurological issues they might be dealing with. One reason that aerobic activity in particular might be helpful in this situation is because that studies have shown that regular exercise increases the circulation of something called BDNF, which has been associated with the repair of neural damage. So what can we do to protect and rebuild our brain health going forward? Here are 3 simple research-backed tips. 1, stay physically active. We've talked about this a lot and we will continue to talk about this. Physical exercise isn't just good for your body, it's good for your brain as well. Even a brisk walk will count. 2, connect with loved ones. Whether it's a coffee date or a phone call, connecting with someone is one of the best things that you can do for your brain health. 3, practice mindfulness. This can help you reduce stress and improve focus, and it only takes a few minutes a day. And you don't need to be an expert on the topic. There are a lot of really great apps out there for mindfulness, like Headspace, that again can be downloaded in a free version and only take a few minutes. The COVID-19 pandemic changed our world in profound ways. but it also reminded us of the importance of mental resilience and brain health. If you're feeling the effects, whether it's brain fog, stress, or memory issues, know that there are steps that you can take to get things back on track. For more insights and practical tips, please be sure to check out our full blog post on this subject. We'll post a link to it in the comments below. Thanks so much for watching, and if you found this video helpful, please be sure to like, subscribe, and share the video with someone else who might find it helpful. And remember, taking care of your brain is an investment in your future. See you next time.